got an appointment?
Yes.
At what time?
12:30. Everyone, James O'Keefe and colleague from Project Veritas here, driving to get the COVID-19 test in New Rochelle. We're going to film and record it. We're going to ask them some questions when we do so. I got a call yesterday from the New York State Department of Health and said that I could get the test. I clarified I do not have symptoms. I've been traveling a lot, interacting with a lot of people who may have it. They said you can get the test. So we're about to get it. We are pulling up into Glen Island Park. There's a police officer here. You can see it says tune in to 16:10 a.m. for more information. So we're going to go ahead and do that.
Welcome to the New Rochelle testing facility at Glen Island. Tests are provided by appointment only. To make an appointment, please call 1-888-364-3065. If you have an appointment, take the identification as well as the identification of everyone else in your vehicle on the dashboard. Please approach the entrance slowly, place your car in park, stay in your vehicle, keep your windows rolled up, and follow the directions of the workers. It is also essential that there be no eating, drinking, gum chewing, abuse of tobacco products 30 minutes prior to the test. Thank you.
Basically, it's a 45-second loop on the radio. I got some Army National Guard guys here with masks on, testing people.
Hey, no, you got an appointment?
Yes.
At what time?
12:30.
12:30? Appointment too?
He's just with me. He's my...
You're not taking the test?
No.
Okay. Anybody else in the car?
Nope, just us two.
Can I see ID? Your favorite to turn your blinkers?
Hazards?
You're good. And just make sure you don't open up the window.
What do you think? Is this as bad as everyone's saying out here? Or should I trust the media?
So it's quick. I mean, for the kids, it's bad. It's just they're gonna stick up like a Q-tip up your nose. I heard it's like a weird feeling. It's not like bad. Like you ever got when you get strep throat, you put something. In the strep throat?
Well, what about the situation itself? Is it as bad as the media is saying? The whole pandemic?
Oh no, it's the flu.
It's just the flu.
It's the flu.
That's all it is.
It's the flu.
Wow, it's not as bad as the CNN is telling me?
Everybody differently.
Is it as bad as Andrew Cuomo is telling me? And is it as bad as Andrew Cuomo is saying on CNN?
I don't know.
It's just a flu, though, basically.
It affects everybody differently.
Okay.
Yeah. So pretty much, like you can have symptoms, I might, or other people don't have. The problem is that it spreads quick, like the flu, like a cold.
What are you guys like Army National Guard, or what are you guys?
Yeah, it's the Army.
You're in the Army?
Yeah, from New York.
Where are you from?
Brooklyn.
Well, thanks for being here.
Yeah, we all over the place. They got us everywhere.
And it's not as bad as the media is saying. I'm hearing you.
No. I'm in the tent with them. I'm doing all this shit.
You're doing everything.
Yeah, and I'm not getting sick. I'm good.
Wow.
Yeah, so.
Well, thanks for being here, man.
Thank you.
I'm speaking with these Army guys. I mean, they're basically just telling me it's just a bad flu. That's all they're saying. It's not as bad as the media is saying everything. Pretty crazy. I mean, that's not what we're hearing in the news.
So I'm going to ask you not to do any photography or video.
Oh, sorry about that.
It's just an issue with HIPAA and stuff.
Of course. Yes, sir. Yes, sir. No problem. Is it as bad as they're saying, this pandemic? Everyone's freaking out. Is it bad? Is it overblown by the media? What is it like?
Is it what?
Is the media accurately reporting, or is it as bad as people are saying?
No.
It's not as bad as the media is making it out bigger.
Yeah.
Wow.
We just want to be precautionary.
Just be precautious. Yep. All right. Yeah. No. Okay. Thank you. Thanks, sir. So this guy just said the same thing. He told us that he said, I asked him, is it as bad as the media says? He says, nope. No. He was clear. He said, we're just being precautious. That's what he said just now. Yeah, two people telling me this is not as bad as what the media is saying. Unbelievable.
How you doing?
Good. How you doing?
Just two today, right?
Just two of us, yes.
Only two tests?
Just two tests. Is it as bad as everyone's saying? Is this as bad? Is the pandemic as bad, or is it just the flu?
I mean, listen, man. I can't really comment on that because I'm not a doctor.
Understood.
Or a biologist or anything.
Yeah.
This is obviously pretty unprecedented.
Yeah.
Taking the proper precautions is always going to ensure your safety and the safety of to those around you.
Understood.
All right, so it's not just the flu. You know what I'm saying?
Yeah.
All right.
Taking precautions. Same sort of lie. We're just taking precautions is what he's saying. Do they allow you guys to get tested?
Yeah, we do.
Oh, good. Good. That's an affirmative. They allow the Army guys to get tested.
Hi, are you James?
I am James, yes.
James, how are you?
Good, how are you guys? You guys get tested, right?
You do?
Can you guys get tested too?
Oh, we can.
Good.
Yeah.
That's
keep everybody safe in the house.
That's very important that you guys.
Very important.
Is this as bad as they're saying? I can't. I don't know if I should trust the media.
You know, I think it's just so new.
Yeah.
It's so new, but I'll tell you what. I've seen people who have nothing more than like a little cough, and that's all they get.
Yeah.
And then some people get really sick, so it's just so new.
It's so new. Understood.
You can go ahead and roll down your window, okay?
All right.
I'm a nurse.
Oh, hello.
This is Alyssa. I'm going to go ahead and put this in your nose, okay?
All right, this is going to be uncomfortable, right?
So actually you came on the right day because we used to go far back. Today we're just going in a little bit.
Oh, that's so good.
So you came just in time.
Just in time, all right.
You missed the far back
Oh, I'm
time.
so happy for
I'm
that.
going to go in just a little. Try to relax for me, okay? Just stay relaxed. Good job. Got to stay in a little longer since we're not going as far back. Well, Timmy sleep. All right, going to go the other side, okay?
All right.
Do you get bloody noses ever?
Yes.
You do. It looks like you might have one coming on, so if you have tissues nearby, just wanted to let you know. It's not a surprise with this weather. It's so yucky.
Oh man, my eyes are watering.
I know. You did a great job. I'm going to go ahead in your mouth, okay?
All right.
Go to the back of your mouth.
How far? Am I going to gag?
Hopefully not.
You're nodding your head like I'm going to gag.
You might gag a little bit, but I'm not going to
I
go
got a
crazy
sensitive
far.
gag reflex.
You do? Okay, so if you do need to gag, maybe just turn back this way.
All right, here we go.
All right, I'm going to be quick. Go ahead, look at me.
Bracing myself.
Look at me and stick your tongue out as far as it can. Good job. Oh, that's great. Not too bad.
I mean, I don't know who to believe. This media is telling me the world's ending. I just can't. It's hard to know. You know?
We come up every day. It's something different. But I would say everybody I've seen come through here,
it's not so bad.
Yeah, but there are bad cases. I know that too.
Yeah.
So we take day by day. Right?
Day by day, right?
Day by day.
Are you guys getting fresh supplies? I heard some people were having to reuse some stuff.
We haven't had to.
You haven't had to reuse anything at all? They're giving you fresh stuff?
Yeah.
Okay.
Yeah, so we're just leaving. Our nose is still tickling a little bit from that. They called it a chimney sweep. We got the version where they didn't have to go all the way back. They just sort of turned it around like 20 times, and it definitely feel like there's a nosebleed. There's the guy who told me right there, National Guard guy, that it wasn't as bad as people are saying. He actually said it was overblown. Some media hysteria. Again, these are the guys on the front lines of this, inside the tents, as they said, and they're saying it's not as bad as we're being told. They just said it was basically a worse version of the flu. Again, their words, not mine. We're not here to project a narrative or even to draw a conclusion. We don't even know who the villains are. We're just trying to give you the information uncensored here as we are departing New Rochelle, New York, on the front lines, former epicenter. This is James O'Keefe.
And if we don't start calling this out.
Tell us your name, your title, where you work.
My name is Jean Stagg. I am a nurse was a nurse with United Healthcare, Community and State Plan of Louisiana. Specifically, I do inpatient utilization management coordination.
And how long have you done that for?
I've worked for United about 7 years. About the last 2 years is when I've done the inpatient utilization specifically.
What brought you here today? Why come to Project Veritas?
Well, I've been seeing some cases come over that were coded as COVID-19 that I felt should not have been coded as COVID-19. I've tried to raise awareness to my leadership and even with the Fraud, Waste, and Abuse Department, and it just kind of fell on deaf ears.
And I do have a few patients that, they went in for reasons outside of COVID symptoms, but they are still being counted on our census as a COVID admission. So that may be, showing some higher numbers as well. They did test positive for COVID, but they went in for other reasons, but they are still being counted in our numbers. So any questions?
Yeah, thank you so much, John. That was great.
Well, that's odd. You identified that there were problems, and who are you speaking to there?
Well, this was our daily leadership call. So it's all of our leadership at the Louisiana Health Plan. And every Wednesday, I report off on our COVID inpatient numbers. You can see the trends. Obviously, we're concerned about when we see the spikes and the peaks. And so I try to explain why we're having peaks. It's not necessarily because we have patients that are critically ill with COVID. These are just the patients that are showing up on our daily census as a primary admitting diagnosis of COVID-19.
When did you first notice this trend of coding all new patients as COVID?
Some of them are legitimately COVID-19. But starting in around March of 2020, that's when I started really tracking and specifically focusing on just the COVID-19 patients. And I would say it's around June or July, I started seeing some cases which should not have been COVID, in my opinion.
We have an example here of, I believe, a gunshot patient. Does that ring a bell?
The one that really got me a while back, and I told Nicole, because I'm like, oh my God, this has nothing to do with COVID. The guy went in for multiple gunshot wounds. And he was coded as COVID. I'm like, he would have never known he had COVID if he hadn't gotten gunshot wounds. I mean, we take the cases as they're sent to us, but I've had a couple where it was like scheduled vaginal deliveries or car wrecks, different things like that, that wasn't their reason for going to the hospital. But, like I said, the only way they're going to show up on my census is if COVID is their primary diagnosis. I don't want to say it's fraud and abuse, but I mean, should I be reporting stuff like that or just letting it go?
I mean, the thing about it is we are finding, people as we work them up who are COVID positive and they had no inclination to even know they might be positive. But I mean, when I assess those folks and put in codes, that's never my number one code in that situation.
Who are you speaking to there?
That is Dr. Morial. She's actually my boss. She is the Chief Medical Officer for United Healthcare Louisiana Medicaid. But she also works as a hospitalist at a local hospital. So she's very familiar. She's been on the front line with the whole COVID.
And how would you characterize her reaction?
I think that she was a little bit surprised as well that her peers or the hospitals were doing that. Like she said, she wouldn't have done it in that way.
Dr. Morial, for that $2,100 fee for the one dose of the antibodies, are people being charged their deductible for that, or is the feds just paying that outright?
The feds are paying for it at this point. But that may not be what's going to happen going forward. The feds are paying for it. But the supplies are somewhat limited.
When Dr. Morial is referring to when the feds are paying for it, who is she talking about?
I would imagine that it has to do with the CARES Act and the federal funds that were allocated through the CARES Act.
Do you believe there's a financial incentive to do this?
I think that there probably is. So I don't see the actual financial side of it, but I have heard rumors, that they are getting money directly from the federal government for COVID positive admissions.
And I'm wondering what the motivation would be for that, because I don't think the reimbursement is going to be any different.
Well, I know that the reimbursement turnover is quicker, right? Because with all of our COVID, it's like a 15-day turnaround for reimbursement, whereas normally we're like a 30-day reimbursement. So,
well, maybe that's driving some of the motivation.
And I thought that they got reimbursed at Medicare rate instead of Medicaid rate.
They do.
I mean, Medicare rate would be significantly higher than Medicaid rate.
Oh, yes. Yeah. I would think that there's some motivation that it's driving higher rates of reimbursement or quicker reimbursement or something. Because otherwise there's no reason to put, something like that as a leading diagnosis in an basically asymptomatic patients.
So typically when a patient goes into the hospital, they go through utilization review. So we have a team of nurses that review the patient's stay. We use a standard set of criteria. All hospitals, all insurance companies use the same set of criteria. And we basically are reviewing it and saying the care that this patient is getting meets criteria. They still need to stay in the hospital. If they don't meet the criteria, we deny the stay. Or maybe they shouldn't have been admitted in the first place. We're going to deny that. What happens is LDH, which is the Louisiana Department of Health and Hospitals, they have suspended utilization review. So they're basically telling the insurance companies that they cannot do medical necessity review. We can't deny anything. When that happens, you can see on that chart the spikes in numbers. It kind of correlates when LDH suspends utilization review.
Now, your critics might say that you're just speculating, that you're just assuming, guessing. How will you react to those critics?
I would say LDH is definitely suspending utilization review. It's unprecedented for them to do this.
What are we looking at here?
This is actually a health plan advisory. They have amended it multiple times. And this is basically telling them that all utilization management for all medical hospitalizations, including but not limited to initial service authorizations and concurrent reviews, must be suspended. Now, this is not specific to COVID-19. This is every single hospital admission. We're not allowed to do medical necessity review. So it gives the hospitals free rein to admit anything they want, code it however they want, keep the patients in the hospital as long as they want, and we're not going to deny anything.
Who is giving these directives?
This is coming from LDH, which is the Louisiana Department of Health and Hospitals. And I'll also point out, too, that LDH meets with all of the hospital heads, the CEOs of all of the hospitals. They meet once a week with the governor, and they discuss strategies and how they're going to go forward dealing with this COVID pandemic. COVID it's interesting because it's the elephant in the room that you're not allowed to talk about.
So what's your message to the doctors watching this feeling betrayed by you?
Well, I mean, I hope they live up to the oath they took to do no harm. To me, this is dishonest. I don't know that it's illegal because it's being allowed to happen by the CDC. I would hope that they would stand up to their hospital administration, because I'm sure they're getting pressure from their administration to test everyone, test them multiple times, get that COVID diagnosis on the chart. But I would hope that they would stand up. I mean, we have to stand up and fight this. COVID is never going to end if we don't start calling this out, what we see.
When I see a patient, and if the patient is presenting with other symptoms that aren't suggestive of a COVID infection, even though they may test positive for COVID, that's not my primary diagnosis.
Know that the two doses of the vaccine offer very limited protection, if any. The 3 doses with a booster, they offer reasonable protection against hospitalization and deaths. Against deaths, I think very good. And less protection against infection.
But what also was concerning in the Scandinavian data, which I was sharing with you, is that when you start mixing them, that even went higher. So if you give, like, we're going to give two, you're going to get Pfizer and then a Moderna or something like that, that data was more concerning. The odds ratios were higher in those.
In 2020, when we had the massive assault with COVID-19, we didn't have an increase in stillbirth. That stillbirth rate actually dropped down to 5.73 from about 5.83 per thousand births, which was the aggregate of the 3 prior years.
So again, in your field, you didn't see that impact in terms of health outcomes from the disease? Only till the vaccine was rolled out?
That's correct. In 2020, the massive assault of COVID-19 and everybody, including my pregnant woman, I did not see this rise. The rise was not seen until after the vaccine. And I have vital statistics of our national vital statistics to prove that.
It's blank on
Boom.
both sides. And
there it is.
It says intentionally blank on it.
That's the data that pharmacists and physicians are basing on giving the injections outside of mainstream media recommendations.
I would like to make this point for anyone who is considering getting their children vaccinated. We've had a hard lesson learned. We've had soldiers who have gotten vaccinated, who've been destroyed. You've heard victims up here who've been destroyed by this vaccine. An EUA product means you have no legal recourse. You could give that vaccine to your child, they could drop dead the next day or end up in a wheelchair like Maddie Gray, and you have no ability to sue the pharmaceutical companies, just like my soldiers. They said it was FDA approved, yet they have not produced any FDA approved vaccines with corresponding lot numbers, and it is the lot number off of that vial. It doesn't matter if the EUA product and the FDA approved product have exactly the same ingredients in that vial. It is the lot number that corresponds to either an EUA product or an FDA approved product that gives you the ability to legal recourse. And once this vaccine was put on the childhood vaccine schedule, the pharmaceutical companies have complete and permanent indemnity from legal recourse should anything happen to you or your children. And our soldiers have been forced to take an EUA product, even though it is illegal to mandate service members be injected with an EUA product.
The excess mortality has shifted so much so that it's pretty phenomenal what you see here in the charts before you. This is not my data, this is the Society of Actuaries. In 2021, in ages 25 through 64, the employed people of our nation covered under group life, they experienced a 40% excess mortality. As quoted by a CEO of an insurance company, just a 10% increase in excess mortality is a 3 standard deviation event or a once in a 200-year flood, so 40 is off the charts. What's interesting about this is that the general overall population experienced 32% excess mortality. This group life policyholder subset is much healthier in general than the overall population, as done by previous studies. They experience mortality 30 to 40% that of the general population. So something flipped in 2021 by 8 points. Go on to the next slide, please. For disability, this is the next data set is the U.S. U.S. Department of Bureau of Labor Statistics. It's pretty simple here. We saw disability take off in May of 2021 above averages. On Wall Street, we follow statistical deviations. There was this 3 sigma event, 3 standard deviation rate of change year over year. And what we found particularly interesting was that the employed of our country experienced a 26% increase in the rate of disability versus the general population, which experienced 11%. To put some numbers on this, we're being very conservative on our start date. The number is probably much higher, but 1.2 million additional Americans in the employed segment of our population left the workforce or didn't leave the work, they got disabled. That is the size of the state of Wyoming and Vermont combined. They've disappeared from the labor force. So if you're seeing labor shortages all around the country, this might be one of the explanations.
You see something like 10 to 15% excess mortality continuing as recently as the past few months. And so, that's very troubling. But if we roll to the next slide, the senator asked us to show just the one chart that tells the entire story. This is that chart. The UK government, until this summer, was reporting a data series that showed the relative mortality rates for the vaccinated and unvaccinated by the number of doses of the vaccine. We've done what we think is really professional work with this, and we think it simplifies down to a conclusion that says that through the last available data set, the people in the UK who took the vaccine have a 26% higher mortality rate. The people who are under the age of 50 who took the vaccine now have a 49% higher mortality rate. And worst of all, the people who only took one dose of the vaccine have approximately 145% worse mortality rate. That last data point is on its face confusing, especially because it seems like there's more and more, it just doesn't make a ton of sense unless you realize that what's going on with this really is that the people who took the dose, the first dose in the United States, that's about 12% of people, but then stopped taking any other doses. Those people, through their choice to stop, disproportionately the ones who were harmed. And so what we're concluding is that if you happen to be an unlucky person who was in some fashion even moderately injured, with a minor injury, you decided not to continue, the statistics, the best statistics we have, show that you're going to have, at least through today, maybe it'll get better, and obviously we're all here because we're hoping to find treatments and cures and screening and interventions, but if that doesn't happen, we have to assume that this is now the baseline. There's going to be 145% higher mortality. And if you were to take these numbers and just apply them to the United States, that ends up being something like 600,000 excess deaths per year in the United States from this higher vaccine-induced mortality.
Right now in this country, roughly 75% of the country has gotten a single shot. Just about 65% have gotten half vaccinated. So consider that, factor that within the natural immunity. We're at herd immunity right now. Joining you in this legislation, Senator Loomis, Senator Roger Marshall, Utah Senator Mike Lee, and looks like Dan Crenshaw is moving something on the House side. Has any Democrat expressed they want to join you?
No, there will be all kinds of different pieces of legislation pushing back on this mandate. But, Brian, something else I have to tell America. We do not have an FDA-approved vaccine being administered in the U.S. The FDA, played a bait and switch. They approved the Comirnaty version of Pfizer drug. It's not available in the U.S. They even admit it. I sent them a letter 3 days later going, what are you doing? What they did is they extended the emergency use authorization for the Pfizer drug vaccine that's available in the U.S. Here it is more than 30 days later. They haven't asked that very simple question. If you're saying that the Pfizer drug is the same as the Comirnaty, why didn't you provide FDA approval on that? So there's not an FDA-approved drug. And, of course, they announced it so they could push through these mandates so that people actually think, oh, okay, now these things are FDA-approved. They are not. And, again, maybe they should be, but the FDA isn't telling me why.
And you know what? In the minority, you have a lot less power, and that's pretty obvious. You'd be even more aggressive. Senator Ron Johnson, keep up the fight. I could tell you more, but I just don't have time. There he is. Senator Johnson, welcome. First off, the vaccine mandate. You're moving legislation to move it forward. Why?
Because the mandate is unconstitutional, and it makes no sense, Brian. But what we do know, again, follow the science. We know that even fully vaccinated individuals can still get infected. They can still transmit. So why would we segregate the society based on vax versus unvaxxed? I was on the floor of the Senate yesterday. Our CDC is not providing us the information we really need so the Americans can have an informed choice over their own health autonomy. But England is providing some pretty good information. We found out from England in their technical briefing number 23 covers about 7.5 months worth of data, 600,000 new Delta cases, 2,500 deaths. 1,600 of those, 63% of those deaths were with the fully vaxxed population. So again, what is the point to these divisive mandates that are going to be devastating for healthcare. It's going to affect military readiness, as your previous guest talked about. I am talking to whistleblowers that have gag orders on them. They can't tell the truth about what is happening inside the military, inside our healthcare facilities. This is going to be a disaster, and there's no reason for it whatsoever.
Yeah, we were supposed to have one of those whistleblowers on, and they got threatened by the military, so they got pulled back.
Often, when you get into the real world, the effectiveness of vaccines falls short of the original efficacy. That is not at all the case with the vaccines for COVID-19. So now we have two vaccines that are really quite effective. The mRNA vaccine, highly effective, extraordinarily efficacious, 94 to 95% for mild to moderate disease, and virtually 100% efficacious, because the real world effectiveness is even more impressive than the results of the clinical trial. We've got to make sure we clarify that with people. It has nothing to do whether or not it's effective. We know it's highly effective. Highly effective.
Come on, man.
Then when you get a sequence of a virus and it looks like a relative of a known nasty pathogen, just like we did with SARS, we found other coronaviruses in bats, a whole host of them. Some of them looked very similar to SARS. So we sequenced the spike protein, the protein that attaches to cells. Then I didn't do this work, but my colleagues in China did the work. You create pseudoparticles, you insert the spike proteins from those viruses, see if they bind to human cells. And each step of this, you move closer and closer to this virus could really become pathogenic in people. So you narrow down the field, you reduce the cost, and you end up with a small number of viruses.
Viruses are. So if you want to find the next pandemic, you should do a lot of work in South America, where there are lots of bat species harboring lots of unknown viruses. You should also do a lot of work in Southeast Asia. So this becomes actually useful. So working with the USAID EPT PREDICT program and funding through NIAID to work on coronaviruses in China, we were able to test out this idea of predicting what the next emerging disease might be. So we've all heard of SARS. We know that SARS is carried by civets. Well, actually, the host of SARS-like viruses, the viruses that the SARS coronavirus emerged from, are bats. We discovered this a few years ago, published it. We found about 5 different viruses. You can see these ones in green. So we thought, okay, we've got an interesting set of viruses. It seems to be the origin of SARS. They're found in bats in China. It's a nice paper. We published it, I think, in Science, and it was quite interesting. But then PREDICT came along, the USAID program to discover new viruses in wildlife, and we worked in China to go out and do surveillance in other bat species and say, how many other SARS-like viruses are there? Is there something even closer to SARS? And sure enough, there was. And we've now found a very large diversity of SARS-like coronaviruses. Some are almost identical to SARS. In fact, there's one cave in Yunnan province that has every genetic element of the SARS coronavirus circulating in bats. And there are people out there who are hunting bats in that cave, eating them, people who live close by. And we're now doing surveillance of the people, and we've found using NIAID funding that actually there is potential of spillover into those people. We're starting to see some worrying signs in that part of the world. So here's a way to take the predictive side, go out and actually find evidence of a SARS-like virus spilling over into people, potentially.
Then we started looking, where did they come from? And we went out to southern China and did surveillance of bats across southern China. And we've now found, after 6 or 7 years of doing this, over 100 new SARS-related coronaviruses, very close to SARS. Some of them get into human cells in the lab. Some of them can cause SARS disease in humanized mouse models and are treatable with therapeutic monoclonals, and you can't vaccinate against them with the vaccine. So these are a clear and present danger. Yeah. We've even found people with antibodies in Yunnan to SARS-related coronaviruses, so there's a human exposure.
Right.
We're now doing surveillance. We're just beginning another 5 years of work to look at cohorts in southern China to say, well, how frequent does this spillover happen, and is it associated with disease? Because I expect, just like Nipah in Bangladesh, there are dozens and dozens of small spillovers going on the planet at any one time, which we just never see.
Sure. Yeah, they never amplify. There are a few cases, and they're just absorbed in the illness, the overall illness of the population, right?
Now, you could say, so who cares? And that's one argument. But our strategy is any one of those could become pandemic. There's a lot of stochasticity in what happens then.
Yeah.
So if we look at all of them, understand patterns, try and reduce the number of spillover events, we've got,
But if you're saying these are diverse coronaviruses and you can't vaccinate against them, there are no antivirals, what do we do?
Well, so I think that coronaviruses are pretty good. I mean, you're a virologist, you know all this stuff, but you can manipulate them in the lab pretty easily. It's just spike protein drives a lot of what happens with the coronavirus, zoonotic risk. So you can get the sequence, you can build the protein, and we work with Ralph Barrick at UNC to do this. Insert it into a backbone of another virus, and do some work in the lab. So you can get more predictive when you find a sequence. You've got this diversity. Now, the logical progression for vaccines is if you're going to develop a vaccine for SARS, people are going to use pandemic SARS as
sure.
But let's try and insert some of these other related and get a better vaccine.
And I guess also knowledge of what's there. If you see something emerging, it give it a head start on making a vaccine or a therapeutic.
That's true, and better knowledge of where they are as well, so that you can put your money into these clinics that matter.
Senator, with all due respect, I disagree with so many of the things that you've said.
You're still unwilling to admit that they gained in function, they gained in lethality.
According to the definition that is currently operable,
we're not going to get anywhere close to trying to prevent another lab leak of this dangerous sort of experiment. You won't admit that it's dangerous, and for that lack of judgment, I think it's time that you resign.
Project Veritas has obtained never-before-seen military documents regarding the origins of COVID-19, gain-of-function research, vaccines, potential treatments which have been suppressed, and the government's effort to conceal all of this. Dr. Anthony Fauci has testified many times before Congress stating that the U.S. government was never involved in gain-of-function research at the Wuhan Institute of Virology.
Will you today finally take some responsibility for funding gain-of-function research in Wuhan?
Senator, with all due respect, I disagree with so many of the things that you've said. First of all, gain of function is a very nebulous term.
But the thing is you're still unwilling to admit that they gained in function when they say they became sicker. They gained in lethality. It's a new virus. That's not gain of function?
According to the definition that is currently operable,
we're not going to get anywhere close to trying to prevent another lab leak of this dangerous sort of experiment. You won't admit that it's dangerous, and for that lack of judgment, I think it's time that you resign.
You have said that I am unwilling to take any responsibility for the current pandemic. I have no responsibility for the current pandemic.
That assertion is based on the NIH's definition of gain of function. However, the documents we've obtained refute that. The documents in question stem from a report at the Defense Advanced Research Projects Agency, better known as DARPA, which were hidden in a top-secret share drive. But what is DARPA? They are an agency under the U.S. Department of Defense, which facilitates research and technology with potential military applications. Dr. Stephen Walker was the director of DARPA at the time of the EcoHealth Alliance proposal. A source sent us this video of Dr. Walker talking about research they were exploring related to mRNA technology and its potential application with military personnel in the field.
DARPA, about 5-6 years ago, we stood up an office called the Biotechnology Office, and the real purpose of that was to understand how biology worked and then build, design, build, and test cycles where you could engineer microorganisms to do things that you want to do.
Though the main report regarding the EcoHealth Alliance proposal leaked on the internet a couple of months ago, it has remained unverified until now. Project Veritas has obtained a separate report to the Inspector General of the Department of Defense, written by the U.S. Marine Corps Major Joseph Murphy, a former DARPA fellow. Major Murphy makes claims in his report to the Inspector General that, if true, could be damning to the official narrative that has been played out to the world over the past 2 years. Major Murphy's report states that EcoHealth Alliance approached DARPA in March 2018, seeking funding to conduct gain-of-function research of bat-borne coronaviruses. The proposal was named Project Diffuse. DARPA rejected the proposal because the work was too dangerous and could violate the gain-of-function moratorium, despite EcoHealth's position that it would not. According to the documents, the NIAID, under the direction of Dr. Fauci, did not reject the proposal. They went ahead with the research at Wuhan and several sites across the U.S. Dr. Fauci has repeatedly maintained his position, under oath, that the NIH and NIAID have not been involved in gain-of-function research with the EcoHealth Alliance program. This appears to be contradictory to Major Murphy's analysis and the rejection from the Biological Technologies Office at DARPA. Major Murphy's report goes on to detail great concern over the COVID-19 gain-of-function program, the concealment of documents, the suppression of potential curatives like ivermectin and hydroxychloroquine, and the mRNA vaccines. To be clear, Major Murphy is not the source of our reporting. As far as we're aware, he has done nothing that violates his oath of service to our country. We were able to track him down, and though he couldn't go into detail about the hidden documents, he did offer this heartfelt statement.
I offer no comment on the investigation or internal Marine Corps deliberations. I offer a brief comment to those that desire answers and to those that withhold them. To those seeking answers, I offer encouragement. There are good people striving for the truth, working together in and out of government, and they succeed. To those that withhold, I pray for you. Find the moral courage to come forward. Don't let a lie be our legacy to posterity. People will forgive. A commitment to truth is in the heart of this nation. Semper Fi.
Project Veritas reached out to DARPA for comment regarding the hidden documents and spoke with the Chief of Communications, Jared Adams.
Doesn't sound normal to me. No, like I said, if something resides in a classified setting, then it should be appropriately marked. I'm not at all familiar with unmarked documents that reside in a classified space. No, that, like I said, that doesn't sound like. I mean, it's not good practice to put unmarked materials in, in a classified space. But there may be cause to, because something is determined to be classified, but it wasn't originally marked appropriately. I'd be happy, Robert, honestly, to investigate and talk to the people who would own this document within the agency, ideally the director of our biological technologies office or the deputy director of that office, and try to ascertain why it was the case.
So here's the question. If the Department of Defense, the same people who make our nuclear arsenal, felt this research was too dangerous to proceed with, why in the world did the NIH, NIAID, and EcoHealth Alliance recklessly disregard the risks involved? Did they purposefully change the definition of gain of function in order to bypass the moratorium? Further, who at DARPA made the decision to bury the original report that could have raised red flags to the Pentagon, the White House, or Congress, which may have prevented this entire pandemic that has led to the deaths of 5.4 million people worldwide and caused much pain and suffering to many millions more?
It hasn't probably been done because the government doesn't want to show that the darn vaccine is full of shit.
Tell us about who this person is.
Dr. Gonzalez is one of our emergency room doctors at Phoenix Indian Medical Center.
And she's a federal employee?
Correct.
Now you got this guy in room 4 who got his second dose of vaccine on Tuesday, has been short of breath.
He's got myocarditis.
Yes.
Oh, this is bullshit.
Now
let's see. Probably myocarditis due to the vaccine.
Right.
But now they're not going to blame the vaccine.
Well, and you know what? But he has an obligation to report that, doesn't he?
They are not reporting.
Right.
Because they want to shove it under the mat.
What patient was she referring to?
She was referring to that patient, that 30-something-year-old patient that had congestive heart failure.
And in that particular patient's case, it was not reported.
No.
The problem in here is they are not doing the studies. People that had it, and the people that have been vaccinated, they're not doing any antibody testing.
It's super fishy.
Not that it hasn't been done, it hasn't been published.
It hasn't probably been done because the government doesn't want to show that the darn vaccine is full of shit.
The government doesn't want to show that the vaccine is full of shit.
It's not doing what its purpose was.
May I see your badges? You're Jody O'Malley with the Department of Health and Human Services. This is the United States government identification. I'm looking at the CDC website. It says that you're required to report adverse events following vaccinations. One of those would be congestive heart failure.
That's a huge one.
Were there other instances that they didn't report?
Oh, I've seen dozens of people come in with an adverse reaction.
Yeah, it's really sad. She had just come back from surgery, from leave.
So what are we looking at here?
You're looking at me transferring her to a higher level of care that could handle her condition.
And this is a colleague at your hospital who got sick.
She didn't want to take it because of her religious beliefs. And she was coerced into taking it.
Why are you choosing to blow the whistle? It's not what a lot of people would do. They're scared, they're afraid. Are you afraid?
I wouldn't necessarily say I'm afraid, because my faith lies in God and not man. This is evil at the highest level. You have the FDA, you have the CDC that are both supposed to be protecting us.
Are you afraid they're going to retaliate against you?
Yeah. I'm a federal employee. What other federal employees do you see coming out?
But you put your faith in God.
Amen.
The government doesn't want to show that the darn vaccine is full of shit.
There needs to be a registry of the people who aren't vaccinated. That's happening there in Germany. I'm going to go door to door instead of going, oh, just your booster shot.
Don't get the vaccine.
Slide it till you know.
She didn't want to take it because of her religious beliefs. She was coerced into taking it.
They are not reporting because they want to shove it under the mat.
Why are you choosing to blow the whistle? Are you afraid?
I wouldn't necessarily say I'm afraid. My faith lies in God and not man. My name is Jody O'Malley, and I'm a master's prepared registered nurse.
Well, first of all, your hospital is run by HHS, correct?
I work for Health and Human Services with Indian Health Services branch for the Native Americans.
These are federal employees.
Yes.
And we work for the government, so, I mean, the main thing is we have to follow.
I know. I mean, that's another thing. I don't know how much longer I'll be here.
And the protocols here.
I know.
Are the policies and administrators coming directly from the federal government?
Yes.
The problem in here, they are not doing the studies. People that had it, you know, and the people that have been vaccinated, they're not doing any antibody testing.
Now you got this guy in room 4 who got his second dose of vaccine on Tuesday, has been short of breath. Okay, now his BNP is elevated, D-dimer elevated, ALT, all his liver enzymes are elevated. His PTINR is elevated.
He's got myocarditis.
Yes.
Oh, this is bullshit.
And then let's see.
It's probably myocarditis due to the vaccine.
Right.
But now they're not going to blame the vaccine.
Well, and you know what? But he has an obligation to report that, doesn't he?
Oh,
it happened. Right, what is it? 60 days after, if you see anything?
They have got to.
But how many people are reporting?
They are not reporting.
Right.
Because they want to shove it under the mat.
In this instance with Dr. Gonzalez, what patient was she referring to, or without saying
She
the name?
was referring to that patient that had congestive heart failure.
Congestive heart failure. And in that particular patient's case, it was not reported.
No.
I'm going to have to transfer you to another hospital. Okay. We don't have cardiologists here. And what you're developing is like a congestive heart failure. Okay? And that's not good. I don't know where this is coming from. On July 29th, you had the first COVID vaccine, and August 19th, you had the second. You know, you don't have COVID, okay, but you have got a lot of symptoms, you know, and you're developing congestive heart failure.
Were there other instances that they didn't report?
Oh, I've seen dozens of people come in with an adverse reaction.
Was one of the ones you saw a 15-year-old with blood clots?
Yeah, so I was just covering a nurse. He's in here with bilateral PEs, but he's fine. And I'm like, okay. So he wasn't on oxygen or anything like that. And I said, was he vaccinated? And then she's like, I don't know. So then I looked in the chart, and he was. He had the Pfizer vaccine at the end of July, and he was due for his second dose. So this is essentially 2 to 3 weeks later. Most likely cause of hypoxia, unusual PE at this age. Unclear etiology. They don't know why he got it.
So how do we know that the blood clots, or how do you know that the blood clots are a result of the COVID vaccine?
Because this is a 15-year-old, normal weight, healthy child. No reason for him to have a blood clot.
It's a shame they're not treating people. I know. Like they're supposed to, like they should. And I think they want people to die.
And how many have you seen that have gotten vaccinated here?
That got sick and side effects? A lot.
A lot?
Have you seen it too? Yeah.
Yes. And I'm like, who's writing the VAERS report?
Nobody, because it takes over a half an hour to write the damn thing.
Right.
The CDC website, it says that you're required to report adverse events following vaccinations. Is there a policy at the hospital for reporting these complications? No.
There's never been any directive sent out on reporting. With this vaccine, we are in stage 3 clinical trials. Normally, stage 3 clinical trials is where you gather your data. What the responsibility on everyone is to gather that data and report it. And if we're not gathering that data and reporting it, then how are we going to say that this is safe and approved for use?
How come after 18 months we haven't had any research? Isn't that fishy to you?
It doesn't.
It does. It is
doesn't.
It's super fishy.
It's not that it hasn't been done. It hasn't been published.
It hasn't probably been done because the government doesn't want to show that the darn vaccine is full of shit.
What does she mean by full of shit?
It's not doing what its purpose was.
And what is Dr. McGee saying in that video?
He's trying to defend the vaccine.
Why would he do that?
Because that's his view on it. Okay. His view is get the vaccine, it's science, right? If we all just get it, this will all be over with.
Such a bunch of bullshit.
What we're gonna have to do, since we're on the inside, I'm thinking about it.
And what do we do?
I don't know, but there's so much I want to blow up.
So much. How do we do that?
Like, Project Veritas.
Why are you choosing to blow the whistle? It's not what a lot of people would do. They're scared, they're afraid.
What prompted me to do this was when I was house supervisor one night, and one of my co-workers had taken the vaccine, and she didn't want to. She had went throughout this entire pandemic working in the intensive care unit. Pretty much was a COVID unit.
Yeah, it's really sad. She had just come back from surgery from leave 2 weeks ago, a little over 2 weeks, and then got her first dose of vaccine after surviving this entire pandemic.
She didn't want to take it. She didn't want to take it because of her religious beliefs. And she was coerced into taking it. And it's like, nobody should have to decide between their livelihood, being a part of the team in the hospital, or take the vaccine. Now we're just making people take it, and then there's reactions to it, and then you have a medication that has been shown effective and surely has no adverse reactions for trying it.
Did Dr. Bakwa talk to you about prescribing ivermectin for?
Not a lot of this facility.
And so physicians can't prescribe off-label use medication here?
Not for COVID. They did it with hydroxychloroquine, and it was really bad, and so they are not allowing it right now.
She said, yes, I would agree to write for this because she's not contraindicated. And
Dr. Bagwa said that?
Yes.
I am stuck. I am told you are absolutely not to use it under any circumstances whatsoever for somebody with COVID unless you don't want to have a job. I am not going to lose my job.
Damn.
They were not allowing, they were going to lose their job if they allowed you to use that drug.
Right. Nuts. Right now, what is plaguing this country is the spirit of fear.
Are you afraid?
It's my career, it's how I help people. But am I afraid? I wouldn't necessarily say I'm afraid because my faith lies in God and not man. So I have 2 older kids that are on their own. And I have a 12-year-old at home that I care for on my own. What kind of person would I be if I knew all of this? This is evil. This is evil at the highest level. You have the FDA, you have the CDC that are both supposed to be protecting us, but they are under the government. And everything that we've done so far is unscientific.
Are you afraid they're going to retaliate against you?
Yeah. I'm a federal employee. What other federal employees you see coming out?
But you put your faith in God.
Amen.
Power, Deception, Propaganda. A new book by James O'Keefe. Pre-order now at AmericanMuckraker.com. Power, Deception, Propaganda. A new book by James O'Keefe. Pre-order now at AmericanMuckraker.com.
Get blow darts of J&J and go to the unvaccinated, blow it into them, blow dart it into them. I remember reading about how with COVID trials they were having an issue recruiting African American people.
Can't blame them.
I can't, but at the same time, like, blow dart. It's where we're going. There needs to be a registry of the people who aren't vaccinated. Although that's sounding very Germany.
The Germany that you're thinking of, is it?
Nazi Germany. I mean, think about it like the Jewish Star.
You look like the FDA or something?
Yeah.
Again, so in order.
Blow dart. It is the perfect answer. And since J&J is an mRNA, you have no issue of it counteracting with anything else. So again, you just shoot everyone. Your own dart. Easy.
How do we reach the minority populations?
Blow dart is always the answer.
Yes.
I will cheers to that.
Yes, cheers.
And the people who are like, oh, the vaccine's terrible, it's the Antichrist, they're like, yes, our savior. So if they start handing out vaccines, I'm going to go door to door and stab everyone. Oh, it's just your booster shot. Stick your arm out.
Exactly.
What's that? Oh, it's just a vitamin C shot. Again, if you're an undercover journalist, you can't quote me. Again, if you're an undercover journalist, you can't quote me.
The government doesn't want to show that the darn vaccine is full of shit.
There needs to be a registry of the people who aren't vaccinated. That's sounding very Germany. I'm going to go door to door and stab everyone. Oh, it's just your booster shot.
She didn't want to take it because of her religious beliefs. She was coerced into taking it. They are not reported because they want to shove it under the mask.
So they're testing on the white people now.
How do we reach the minority populations?
Blow darts would probably still our most be squashed. Blow dart is always the answer.
Yes.
Cheers for that.
Yes. You look like the FDA or something?
Yeah. I remember reading about how with COVID trials they were having an issue recruiting African American people, and it was because of a different medication the government tried to do that was specifically designed to kill African Americans.
Oh, so like a mistrust thing.
Yeah.
But this thing's safe though.
And we know that now,
Yeah.
but like again, I think there is still this big mistrust in, like, it's deep rooted in.
Yeah. Can't blame them.
I can't, but at the same time, like, blow dart. It's where we're going. Yeah. I mean, my personal thing is like, you know, you get blow darts of J&J, and again, I'm a little cynical.
Blow darts of J&J?
Yeah, Johnson & Johnson.
What do you mean?
Like, go to the unvaccinated, blow it into them, blow dart it into them.
Yeah.
That's where I am at this point.
How do we reach the minority populations? Is there a way to do it? I want to get back to normal.
I'm sure there is. I'm not the person to answer it, though, other than blow darts. Because I think that is a great solution.
Well, the problem with that is African Americans, they might think that it's like almost like a callback to like getting shot by like the...
It's time. We'll go for the whites first.
Oh, there you go.
We'll post like video campaigns about doing it to the whites first, and then they can't call it.
Then they can't say it's racist.
Exactly.
Because it almost harkens back to like the thought of being shot in Africa by a blow dart and then put in a...
We'll have to hire some Amazonians first.
Yes.
Because like they'll get it done.
How good are you at blowing darts?
Want to see how fast they get an Amazon rainforest tribe out here? Yeah, but I mean, the undocumented immigration isn't much of an issue as like a lot of people make it out to be. I think the issue again is if it's a large population of people who are going to choose not to get vaccinated because they don't want to admit that they are undocumented, Again, you're going to create this issue where you got the anti-vaxxers and the people who are choosing not to for that reason, and then you have the vaccine. Again, the obvious answer is blood dark. If we just stick everyone again with the J&J to make sure that everyone's got something, we're good.
I know there's enough to go around, so I mean, it's just how to
again,
so unorganized.
Blow dark. It is the perfect answer. And since J&J is an mRNA, you have no issue of it counteracting with anything else. So again, you just shoot everyone.
I wonder what kind of technology we have right now, like miniature sort of blow darts or anything like that. Something
drone darts. Easy. The white, uneducated, like, it's like all of the colloquial people that we see in like Alabama and all this, and it's like, apparently you need an IQ test, and if you fail below a certain level of IQ, you're getting a shot.
That's a good idea. That would probably put a lot of shots in arms.
Yeah.
Wow. I mean, how feasible is that, though?
That's less feasible than the blow darts. I think the blow darts are probably still our most feasible option.
Alright, cool.
And like, the funding's there. It's easy to do. Blow darts. That's all we need. Done.
Yeah. Seriously.
It's terrible, but at this point I'm like, I don't care about your bodily autonomy. Because it's not just your bodily autonomy that you're putting in jeopardy.
You see any of that stuff going on with, what's her name? Nicki Minaj. I mean, I just don't understand why she's opening up her mouth and causing more harm. You know?
Well, see, the issue is that, like I just said, we look at it as harm because we think, and like I think most educated people would think, the vaccine's a good thing. Whereas, you know, on the other side of the coin, the people who are like, oh, the vaccine's terrible, it's the Antichrist, are like, yes, our savior.
But my dad doesn't know anything. So I not on my problems with him were not on your level, but my problems with him were like, he's anti-vax.
Okay.
He's,
So we need a blow dart to go visit him.
Yeah. Yes. So,
hey Dad, stick your arm out.
Exactly.
What's that? Oh, it's just a vitamin C shot.
Exactly. In my opinion, the fitness industry dealing with this, like, you have to force it door to door.
Yeah.
And what are the chances of that happening?
I mean, census goes door to door if you don't respond. So, we have the infrastructure to do it. It costs a ton of money. But I think at that point there needs to be a registry of the people who aren't vaccinated. Although that's sounding very Germany at the same point.
But, I mean, we have to get back to normal. So.
I agree. It's hard.
Yeah.
Because I don't think there is, again, like I said before with other things, I don't think there's a good choice. There isn't a black or white choice. There's only gray choice. Because the black or white isn't feasible.
Yeah, I'm at the level where I'm like, honestly.
I agree. I'm also there. But what I think and what the government will actually do are very different. Yeah, because if they start handing out vaccines, I'm going to go door to door and stab everyone. Oh, it's just your booster shot.
There you go.
There you go.
There you go. Yeah.
I'm not a trained licensed professional. It's fine.
I mean, you could tell them it's like a flu shot or something. It's a monthly.
I mean, I'm sure they don't take that either. So the death rate's gone down. This is the one thing that I hate about statistics is, you know, sometimes you can play with them in the way that you want to show the information. Because you can definitely do that, you know. If you let COVID kill off everyone over 60, let's say, everyone under that age is going to have an easier recovery period for the most part, so the death rate would obviously go down. It's like, oh, we're doing a great job, death rate's down, but it's like, okay, you've killed off like 400 million people.
Yeah.
And again, that's one of the things that statistics is like, oh, you play around, sometimes you can find the thing to tell you what you want it to tell you.
Well, I just figured that it would be a no-brainer that they would push for the booster shots.
Yeah, again, I understand FDA's position because it was like, oh yeah, they only produce the data for 65 and older with these booster shots, so they don't have the data to say, oh yeah, it does the same thing for 20-year-olds. And it's like, okay, but do we think it's harmful for 20-year-olds to get a booster shot? This is my question to FDA, and it's like, they're like, they didn't provide enough data, and it's like, okay, I get it, but I don't at the same time. But that's my personal opinion. Again, if you're an undercover journalist, you can't quote me.
Yeah.
So this is the thing that's always like really crude as an economist, is we have a certain value that we put on each human life. And so when I think about like government mandates like that, I think about it in those terms, which, you know, is terrible because I think each human life is priceless in its own self. But like, okay, so if you give 1 million vaccines and 2 of them are blood clots, okay, you have a loss of $10 million about in your like government regulation type world framework. Because each life accounted for about $5 million. And again, it can range and all that stuff, but like, okay, so if you give these 1 million vaccines, you get everything back to normal, are you making more than that $10 million loss, or are you not? And that's the way that like we're trained to like try and think about these things in terms of cost-benefit analysis, that type of stuff. Again, my own opinion is very different, but...
So you're trained, can you explain that in layman's terms better?
Yeah, so like with our econ training, with like, when I learned how to do my job.
Will they like ever play politics with like the science, or?
So, I would think that the general people there, so the people who are the actual scientists, no. But there are political appointees that are generally scientific advisors who are appointed by the president or the commissioner. So they definitely do.
Yeah.
Because, you know, they're being paid based on if the other people are staying in power. Unfortunately, everyone ends up playing politics. But I don't think that the career scientists are. I think that it's the people that they're unfortunately having to report to because these political appointees are being put in place. And that's part of like the Senate confirms the people to then just pick their people.
Let's see, actually. It's Taylor Lee.
Yep.
Would you mind giving me a comment on some statements you've made?
I remember reading about how with COVID trials they were having an issue recruiting African American people.
I can't blame them.
I can't, but at the same time, like, blow dart.
If I was unvaccinated, would you hypothetically want to shoot me with a blow dart?
Yeah, no, I don't want to talk about this. Thank you.
I understand you may not want to talk about this, but this is your opportunity to speak.
There needs to be a registry of the people who aren't vaccinated. Although that's sounding very Germany.
The Germany that you're thinking of is it?
Nazi Germany. I mean, think about it like the Jewish star.
Would you like to give some context to these statements?
So if they start handing out vaccines, I'm going to go door to door and stab everyone. Oh, it's just your booster shot. Stick your arm out.
Exactly.
What's that? Oh, it's just a vitamin C shot.
I mean, you have nothing to say? You're just going to pack up and now leave? You're an employee of the FDA, and, sir, you're really just going to scatter out? Classic, a scurry. Once someone sees their own statements, nothing to say now. Was very candid with my colleague. Classic?
So if it were your kid, would you get them vaccinated?
I don't think they need it.
So what would you say? Homeschool or get the vaccine?
Honestly, I don't think a kid needs to get it.
You know? You shouldn't have to get a vaccine. You're a kid. You know?
Meet scientist Justin Durant and regional business lead Brandon Schatt, officials with pharma giant Johnson & Johnson. Both men echo startling admissions about their own company's COVID vaccine and their concerns on long-term repercussions for children.
Kid, you just don't do that.
Right.
Not something that's so unknown in terms of the repercussions down the road. You know?
So would you say we don't know the repercussions of it?
I mean, how could you, right? There's nobody who's 30 years in that said, hey, I got the vaccine and I don't have a third eyeball.
So what do you think this is about? Do you think it's about the money?
Politics, money.
Okay, so then if you think that babies don't need to get vaccinated, then why do you think there's such a strong push for it?
Justin Durant, scientist at Johnson & Johnson, is clear on one thing. Don't get this vaccine. And he doesn't want you to know that he said that. He even texted our journalist reminding her to keep what he said secret, saying if the public found out, he could get in mad trouble.
Should tell her to not get the Johnson & Johnson one. Don't get the Johnson & Johnson.
I didn't tell you no.
Okay.
I didn't tell you no. I didn't tell you no.
Despite these doubts, Durant appears to embrace his company's role in pushing policies that, quote, inconvenience the unvaccinated into second-rate citizens.
The only way people really act comes to action is it affects their pocket. So it's like if you're working for a big company, you're probably losing your job. That's me, you're the first one in the line. I mean, if you can't work, that's fine enough. But like a second-rate citizen, you can't do anything on a normal citizen. Inconvenience them to the point where it's like, it's the odd, not the odds, but I'm not as much as fucking.
And as to what the media is saying about the Johnson & Johnson vaccine?
So you said I shouldn't trust the media?
In no capacity, she's waiting to trust anything that they say.
The government doesn't want to show that the darn vaccine is full of shit.
It needs to be a registry of the people who aren't vaccinated. That's sounding very mean. I'm gonna go door to door and stab everyone. Oh, it's just your booster shot.
Don't get the Johnson & Johnson.
I didn't tell you no.
She didn't want to take it because of her religious beliefs. She was coerced into taking
They
it.
are not reported because they want to shove it under the mat.
Do you think it's about the money?
Politics, money.
Then why do you think there's such a strong push for it?
Laws like that. If you want to go to a bar, you need to come in with a COVID test. Inconvenience these people so much that they're just ideas.
So that's what we need to do.
That's what we're doing.
In the midst of the growing nationwide vaccine mandates, including mandates for young students, Durant leaves no question about this. Do not take the Johnson & Johnson vaccine, he says. Inconvenience the unvaccinated is something he says, quote, we need to do.
Inconvenience them to the point where it's it's the odd, not the odds, but I'm not as much as you know what I'm saying?
Okay.
I can't go out of state. I can't. My grandma's in Canada. I can't visit her. I can't. It's just. You can't go to France unless you're vaccinated. I can't go to. You just gotta keep doing things like that. So it's you're almost like a second-rate citizen. Which I know that sounds.
You're almost what?
Like a second-rate citizen. You can't do anything on a normal citizen.
A second-rated citizen?
Yeah.
Okay.
Top grade, but when you get it, no ones are just
right.
You can't do shit.
So then how do we punish them?
I mean, if you can't work, that's fine enough. I feel like people listen.
People what?
The only way people really act come to action is it affects their pocket. So it's if you're working for a big company, you're probably losing your job. That's me, you're the first one in the line.
Right.
You know?
So if you're working for a big company and you're about to lose your job, you're going to be the first one in the line.
Yeah.
So true.
Yeah.
So true. So that's what we need. That's smart. That's what we need to do.
I mean, that's what we're doing. Counting straight heads and counting, oh, that's a baby, that's a this, that's a that. You know what I'm saying? It's everyone needs to get vaccinated. You really don't need a vaccine, baby. You really don't need a vaccine, baby. It's in your, you take, especially if it's not going to school, it's not going out, it's in your house, well, you're going to be fine.
So at what age do you think people should?
Once you go out and you have to go to preschool, and you're around kids, I don't know what the hell Johnny down the block was doing. So that's when you do stuff.
Okay, so then if you think that babies like don't need to get vaccinated, then why do you think there's such a strong push for it?
Should tell her to not get the Johnson & Johnson one, is what you're saying? Don't get the Johnson & Johnson.
I didn't tell you no.
Okay. But she doesn't necessarily need to because she's young.
Yeah, it doesn't like be kind of necessary.
Yeah.
But again, she shouldn't. Just out of her civic, it's her civic duty.
Doesn't make that much of a difference. Yeah. So what would you say? Homeschool or get the vaccine?
Honestly, I don't think a kid needs to get it. It's just me.
Why not?
It's a kid. It's a kid. You know? Kids shouldn't have to get a vaccine. You're a kid. You know? You're just a kid. You're not developed yet. Like, you have so much growth. You know? When you're young, you can rebound from the virus. You can fine. You shouldn't be getting it because you could spread to other people. You know? Because you're a kid. You know? She's terrible.
What about it is terrible in your eyes?
It's like the same concept of like you don't do things to kids. You don't put kids through certain things that you put adults through. It's just that kind of category.
Right.
You know, as a kid, you just don't do that.
Right.
Not something that's so unknown in terms of the repercussions down the road. You know?
So would you say we don't know the repercussions of it?
I mean, how could you, right? There's nobody who's 30 years in that said, hey, I got the vaccine and I don't have a third eyeball.
So you're probably loving work right now then.
It's like weird because they ordered us to take the J&J vaccine. I was like, good. I mean, just because of the effectiveness, but like.
So you didn't take it?
Oh no, I did. I took the.
Oh, you took it? Okay, yeah. So why is everyone leaning away from the Johnson & Johnson one?
It could be in part like an FU. I'm not going to get your vaccine if you're going to force me to do this. It
Right.
could be too because people just don't trust it. You know?
But never Johnson & Johnson. Why though?
60% thing in the blood clots. They reported.
Brandon Schatt goes on to explain his views and that the problem boils down to a lack of transparency within J&J for both political and financial reasons.
So what do you think this is about? Do you think it's about the money?
Collection of everything.
What?
The collection of everything, I bet.
What do you mean?
Politics, money. A lot of people trying to make the right decision, but being stuck in their position of really being influenced by somebody to go one side or the other. I don't think anybody's going to say anything either if there's something going on, you know?
Why not?
People are private, you know? Even J&J.
What?
Even J&J is.
They're private?
You don't hear about this stuff. Like if something bad is going on, like, all right, for the 13 years that I've been there, at least my time in consumer products, they've had Tylenol that was laced with like cyanide. If something bad happened there, they had the recall products.
I don't know if I trust people. I don't know if I trust, like, what the media tells us, you know.
Should.
So you said I shouldn't trust the media?
No, why should we?
Right.
Why the hell should we?
Right.
No chance.
What do you mean by that?
In no capacity should we trust anything that they say.
It is startling to hear employees of one of the largest pharmaceutical companies in the world refusing the very products they develop. If you are part of one of these big pharma giants, we invite you to reach out to us at veritastips@protonmail.com. Be brave. Do something.
Power, Deception, Propaganda. A new book by James O'Keefe. Pre-order now at AmericanMuckraker.com.
inside portion of the actual virus. So your antibodies are probably better at that point than the vaccination.
Nick Carl is an experienced biochemist at Pfizer with a history of working in the pharmaceutical industry. Nick admits to our undercover journalist that those who've had COVID have stronger immunity than those who've received the Pfizer COVID vaccine.
When somebody is naturally immune, like they got COVID, they probably have better, like not better, but more antibodies against the virus. Because what the vaccine is like I said, that protein that's just on the outside. So it's just one antibody against one specific part of the virus. When you actually get the virus, you're going to start producing antibodies against like multiple pieces of virus. And not only just like that outside portion, like the inside portion of the actual virus. So your antibodies are probably better at that point than the vaccination.
But don't take his word for it. Two other Pfizer scientists echo the same sentiment.
So I'm well protected? Like as much as the vaccine?
Probably more.
How so? Like how much more?
You're protected most likely for longer, since it was a natural response.
We're like bred and taught to be like vaccine is safer than actually getting COVID. You cannot like talk about this like outside in public. If you have antibodies built up, like you should be able to prove that you have those built up.
I mean, I still feel like I work for like an evil corporation. We're trying to keep track of everyone that's been vaccinated versus the census of how many people are actually reported. Basically, our organization is run on COVID money now. You don't talk about anything that can possibly implicate you or like big pharma. Like even if you shut the door to the office, it's kind of like, who's listening?
I specifically have like, oh God, I signed NDAs against this.
The government doesn't want to show that the darn vaccine is full of shit.
There needs to be a registry of the people who aren't vaccinated. That's sounding very dirty. I'm gonna go door to door instead of everyone, oh, it's just your booster shot.
Don't get the Johnson & Johnson.
I didn't tell you no.
She didn't want to take it because of her religious beliefs. She was coerced into taking it.
They are not reported because they want to shove it under the mat.
Oh God, I signed NDAs against this. So your antibodies are probably better at that point than the vaccination.
You're not wearing a wire, right?
Our next installment in the series exposing Big Pharma will feature multiple releases inside one of the nation's largest COVID vaccine manufacturers, Pfizer. The series features not one, not two, but three scientists within Pfizer talking to one of our undercover journalists, making stunning admissions about the COVID vaccine and the culture inside of Pfizer.
Like we're like bred and taught to be like vaccine is safer than actually getting COVID. And that's like honestly, we have to do so many seminars on this. Like you have no idea. Like we have to like sit there for hours and hours and listen to like be like you cannot like talk about this like outside in public. You know, logically though, like if you have antibodies built up, like you should be able to prove that you have those built up. Like and just be like, I don't know, maybe potentially that doesn't seem that crazy.
I had COVID and I have monster immunity after 8 months, so I just got checked last month for antibodies.
I mean, that's no worries. Same thing with my brother.
So should I get the vaccine?
Wait.
Till when?
If your immunity starts to wane, then get vaccinated.
So I'm well protected?
Yeah.
Like as much as the vaccine?
Probably more.
How so? Like how much more?
I mean, so when we came out with, let's see. So right now we're seeing an increase in the Delta variant, mostly not because of the variant, because of basically their antibodies are waning. So they're still protected, but not at that 95% efficacy. It's more like 70%. So you're protected most likely for longer, since it was a natural response.
Mm-hmm.
So basically they're trying to keep track of everyone that's been vaccinated versus the census of how many people are actually reported. So I mean, they're trying to get their numbers, but still you shouldn't have to show anything, which is basically, in my opinion, a violation of HIPAA. No one has the right to ask you if you've been vaccinated, or so it's an invasion of privacy. I don't agree with it. So.
Nick's take on these social mandates would seem to run contrary to his sentiment on antibody immunity. This isn't the first time we've heard this sentiment from a scientist with one of these companies.
How do we get the unvaccinated vaccinated?
I feel like what they're doing, like, for instance, like the city needs like vax cards and everything. It's just like about making it so inconvenient for like unvaccinated people to the point where they're just like, it, okay, you know?
What do you mean?
Like, if you are restricting people that are unvaccinated from doing anything, and then like vaccinated people are allowed to do anything they want, eventually they're just going to be like, let me just get vaccinated.
I mean, you have multiple companies that were basically given a crap ton of money to produce vaccines, and they're pushing them.
So what happens to the monoclonal antibody treatments?
Pushed to the side.
Why?
Money. It's disgusting. You're not wearing a wire, right?
No. You want to check?
I mean, I still feel like I work for like an evil corporation because it comes down to profits in the end, and I mean, I'm there to help people, not to make millions and millions of dollars. So I mean, that's the moral dilemma.
Billions and billions?
I'm trying to be nice.
No,
Yes.
I hear you. I do. I mean, I'll still give you a hard time about it.
Basically, our organization is run on COVID money now.
How so?
Like, it netted like over 15 billion last year.
Chris Croce is a senior associate scientist with Pfizer. He goes on to explain a test that is currently taking place at Pfizer, not to determine the effectiveness, but to see if it is leading to heart attacks.
I'm glad you didn't get any myocarditis.
Yeah.
'Cause that's a concern, right?
Yeah. More so for younger people.
Why?
That's what we're looking into right now.
Oh, cool.
Yeah. So, we just sent like 3,000 patient samples to get tested for like elevated troponin levels. To see if it's vaccine based or so.
What's it look like?
I don't know. We just sent that over this past week, and the last batch will be sent over next week. All external testing. We'll see. Hopefully it's good. Because I mean, if not, then my opinion, that might pull something from the market.
If the scientists believe that the antibody works more effectively than the vaccines, it begs the question, what's with all the federal mandates, regardless of what the data says?
There's ears and eyes everywhere.
What do you mean?
At Pfizer, like in the building. So it's kind of just like, you don't talk about anything that can possibly implicate you or like big pharma. Like even if you shut the door to the office, it's kind of like, who's listening?
These expressed views run contrary to the current public policy affecting millions of people. If you're on the inside of the pharmaceutical company, contact us at veritastips@protonmail.com and stay tuned. We have a hidden camera footage of executives at Pfizer.
It's an argument. Code yellow.
Code yellow, I don't know what that means.
Code yellow.
this seat taken?
Yes.
You work for Pfizer, don't you?
Ooh,
You're
no,
on.
I'm not doing this.
You're a scientist at Pfizer.
Dude, do not.
You-
Absolutely not. What are you doing right now?
So you're on camera saying that the antibodies, if you've had COVID, are better at that point than your vaccination.
So your antibodies are probably better at that point than the vaccination. I like to see any of this. Are you f***ing kidding me right now?
I'm not kidding you. You are on camera explaining.
Why do you have anything about me?
Well, here's a video of you talking.
When somebody is naturally immune, like they got COVID, they probably have better, like not better, but more antibodies against the virus.
You work for Pfizer. Sir, would you just tell the public what you've said privately? You're welcome to drive away if you'd like, but I'm standing in a public parking lot here. This is the most important public health issue of a generation. This is an incredibly important issue. You're a scientist for Pfizer. For Pfizer. How do you sleep at night? And that's Nick Carl for Pfizer. We just want him to be public with the people about what he said privately. The question is, why does he want to keep this secret from the American people?
I specifically have like, oh god, I signed NDAs against this.
Are you Vanessa? Vanessa Gelman. I'm a reporter with Project Veritas.
Vanessa Gelman, who works in Washington, D.C., is Senior Director of Worldwide Research. From Vanessa Gelman.
From the perspective of corporate affairs, we want to avoid having the information on the fetal cell lines floating out there. We believe that the risk of communicating this right now outweighs any potential benefit that we could see, particularly with general members of the public who may take this information and use it in ways we may not want it out there.
Miss, why did you send emails telling Pfizer employees not to report that you guys were using fetal cell lining, miss? What else are you hiding from the public? Miss, what else are you hiding from the public? The public needs to know. Well, there you have it. We wanted to ask her a few questions. She broke out into a sprint. We really think that the public needs to know about the fetal cell lining emails. And we tried to get a comment. She ran. Sometimes they don't want to answer for the fraud that they're committing or the corruption that's going on. We try our best, and the really only question now is who's next.
I'm a journalist for Project Veritas, and a whistleblower with Pfizer recently released your internal emails. And what I want to know is, why did you write an email saying that you would prefer we do not discuss fetal tissue being used in laboratory tests associated with the vaccine program? Why?
Philip Dormitzer, Vice President, Chief Scientific Officer. These are not low-level people here. Copying Vanessa Gelman, we have an approved answer to this question, the question being about fetal tissue, which Vanessa can probably provide, HEK2932. What does that mean, HEK?
Human embryo kidney cells, and it was from experiment 293. From the perspective of corporate affairs, we want to avoid having the information on the fetal cell lines floating out there. We believe that the risk of communicating this right now outweighs any potential benefit that we could see, particularly with general members of the public who may take this information and use it in ways we may not want it out there.
Why would you lie to the American public?
Very connected with communications.
I'd like to talk to you right now since I'm with you. Should the American public trust Pfizer at this point, since a lot of whistleblowers have come out, and even we've exposed scientists saying that the antibodies are better than the vaccine itself?
So your antibodies are probably better at that point than the vaccination.
You know, how can the American public trust you guys at this point, Phil? You don't want to give us any comment about that tonight, Phil? Phil, we expose everybody, just so you know, brother. Once again, we asked the questions, they run away. He did say we can contact his communications department, so that's what we'll do now, but that's how it goes. We ask the questions and they run. Who's next?
ultimately is thinking about mutating COVID?
Well, that is not what we say to the public. No, don't tell anyone this building. You probably shouldn't tell anyone. You probably shouldn't tell anyone. Okay? We're exploring, like, now, you know how the virus keeps mutating?
Yeah.
Well, one of the things we're exploring is, like, why don't we just mutate it ourselves so we could preemptively develop new vaccines, right? So we have to do that. If we're going to do that, though, there's a risk of, like, as you could imagine, no one wants to be having a pharma company mutating viruses. To be, like, very controlled to make sure that this virus that you mutate doesn't create something that, like, you know, it goes everywhere.
Something crazy.
Is the way that the virus started in Wuhan. To be honest, like it makes no sense if this virus popped out of nowhere. Like,
yeah, I know.
Meet Jordan Tristan Walker, a director of research and development strategic operations and mRNA scientific planning at Pfizer.
It sounds like gain of function to me.
I don't know. It's a little bit different. I think it's different. It's like it's definitely not gain of function.
It sounds like it is. I mean, it's okay.
No, directed evolution is very different. Well, you're not supposed to do gain of function research with the viruses. Like,
yeah,
they recommend not. But you do like these like selected directional mutations to try to see if you can make more potent.
Yeah.
So there is research ongoing about that. I don't know how that's gonna work. There not be any more outbreaks because, like, Jesus Christ.
The gentleman seems to have absolutely no moral compass at all.
It's a revolving door for all government officials. It's pretty good for the industry, to be honest.
Yeah.
It's bad for everyone else in America.
Why is it bad for everybody else?
Because if the regulators who have to approve our drugs know that once they stop being regulated, they want to go work for the company, they're not going to be as hard for the company. They're doing their job.
If this is the quality of individuals within Pfizer that are making these huge decisions that risk global public health, it's profoundly corrupt.
What is Pfizer doing, I guess, to optimize, the vaccines now?
Oh, we actually had a meeting about that today, so there's a lot.
Really?
They're doing, I don't know if I should say this.
Our undercover journalist asked Walker how Pfizer is handling the fact that their COVID vaccines are ineffective against virus variants. What he said is disturbing. Listen to this.
We're exploring, like, now, you know how the virus keeps mutating?
Yeah.
Well, one of the things we're exploring is, like, why don't we just mutate it ourselves so we could preemptively develop new vaccines, right? So we have to do that. If we're going to do that, though, there's a risk of, like, as you could imagine, no one wants to be having a pharma company mutating viruses.
Yeah.
So we're like, do we want to do this? So that's, like, one of the things we're considering.
Okay.
For, like, the future, like, maybe we could, like, create new versions of the vaccines and things like that.
Okay, so Pfizer ultimately is thinking about mutating COVID?
Well, that is not what we say to the public. No. That's why it was a thought that came up at a meeting, and we were like, why do we not? It was like, we're going to consider that with more discussions.
Okay.
That exact reaction, right? We're like, wait a minute, like, people won't like that.
That's right. It appears that Pfizer is internally discussing the possibility of mutating the COVID virus themselves in order to tailor a vaccine to sell to the public. Listen to Walker describe in detail just how they would conduct such a scientific experiment, first in living animals.
So the way that we're thinking about it, don't tell anyone this building. You probably shouldn't tell anyone. Okay, bro. So the way it would work is, like, we put them in the virus in these monkeys.
Okay.
And then we successively, like, cause them to keep infecting each other. And we collect serial samples from them, and then the ones that are more infectious, like the virus, we'll put them in another monkey and just constantly actively mutate it. That's one way. Okay. Or we can even do, like, directed, like, simulation, which, like, we tend not to prefer. And then you just sample what the different proteins on the surface of the virus look like over time. Okay. So then you can see the mutation, and you can kind of force it to mutate in a certain way you want. Okay. But you have to be, like, very controlled to make sure that this virus that you mutate doesn't create something that, like, it goes everywhere.
Something crazy.
Is the way that the virus started in Wuhan. To be honest, like, it makes no sense if this virus popped out of nowhere. Like,
yeah, I know.
COVID virus experimentation on live monkeys? This is unethical, to say the least, and Walker describes those experiments as if they are ongoing and not simply a hypothetical discussion.
So, I mean, when is Pfizer going to implement the mutation of all these viruses?
I don't know. It depends on how the experiments work out, because this is just, like, something that's dying, right?
It sounds like gain of function to me.
I don't know. It's a little bit different. I think it's different. It's like, it's definitely not gain of function.
It sounds like it is. I mean, it's okay.
No. No, directed evolution is very different.
Direct evolution?
Directed evolution.
Directed evolution, okay. Well, so, I mean, is that what it is?
Maybe, well, you're not supposed to do gain function research with the viruses, like, they recommend not. But you do, like, these, like, selected directional mutations to try to see if you can make more potent.
Yeah.
So there is research ongoing about that. I don't know how that's going to work. There might not be any more outbreaks, because, like, Jesus Christ.
So, tell me more, like, what's developing with the whole, virus mutation process?
Well, they're still kind of conducting the experiments on it, but it seems like from what I've heard, they're kind of optimizing it, but they're going slow. Everyone's very cautious, like,
Right.
Obviously, don't want to kind of accelerate it too much.
Yeah.
But I think they're also just trying to do it as an exploratory thing, because you obviously don't want to advertise that you're trying to figure out future mutations.
Right. So, did the whole virus mutation thing, like, come from your executive, Sarah?
No, that came from, like, we have, like, chief scientific officers in, like, the other divisions.
In a subsequent meeting, our undercover journalist asked if this type of gain-of-function research is already being studied at Pfizer. But no, as long as it's called directed evolution, Pfizer's in the clear.
What's the goal for Pfizer of doing that?
So part of what they want to do is, like, to try to figure out, to some extent, like, there's all these new strains of variants that just pop up. Why don't we try to, like, catch them before they pop up in nature, and we can develop a vaccine prophylactic for, like, new variants.
Yeah.
So that's why they're thinking, like, if you do it controlled in the lab, then we say, oh, this is an epitope. And so then if it comes out later on, like, in the public, we already have a vaccine kind of working on it.
Oh my God, that's perfect. Like, isn't that the best business model though? Like, just control nature before nature even happens itself, right?
Yeah, if it works.
What do you mean if it works?
Because, like, some of the times there were just mutations that pop up, right, and we're not prepared for it, like with Delta or Omicron,
right,
and things like that. So who knows? I mean, either way, it's going to be a cash cow. COVID will probably be a cash cow for us for a while going forward. Like,
yeah.
I obviously like
Well, I think the whole, like, research of the viruses and mutating it, like, would be the ultimate, like, cash cow.
Yeah, it would be perfect.
Now, you would think that creating viruses to sell the vaccine would be illegal. But no. The pharmaceutical industry, as Walker puts it, is, quote, a revolving door for all government officials, unquote.
A revolving door for all government officials?
Wow.
Yeah, for any industry, though. So, like, in the pharma industry, all the government officials who, like, review our drugs, they come work for pharma companies. Like, the military, like, all the, like, Army and Defense, like, government officials eventually go work for the defense companies afterwards.
How do you feel about that revolving door? Like,
it's pretty good for the industry, to be honest.
Yeah.
It's bad for everyone else in America.
Why is it bad for everybody else?
Because if the regulators who have to approve our drugs know that once they stop being regulated, they want to go work for the company, they're not going to be as hard for the company. They're doing their job.
Right.
We talked to Dr. Robert Malone, physician, scientist, and author, to get his take on the comments made by Jordan Walker.
You're gaining function. You're creating a new function in virus 1 by adding elements from virus 2, infecting one monkey and then another monkey. That's called serial passage. That appears to have been one of the technologies deployed in the Wuhan Institute of Virology with the humanized mouse strains that I believe were obtained from EcoHealth Alliance. That's an example of directed evolution. The gentleman seems to have absolutely no moral compass at all about what he's doing. The hubris and arrogance and immaturity. If this is the quality of individuals within Pfizer that are making these huge decisions that risk global public health with such a casual disregard for the human toll, it's profoundly corrupt in terms of would it be feasible for Pfizer to circumvent international or national law. I think that is undeniable. And the gentleman in your investigative work has clearly indicated that Pfizer believes that it has successfully captured the regulatory apparatus of the United States government and presumably worldwide. Pfizer has completed regulatory capture, is quite proud of it.
With governments turning a blind eye and Pfizer hiding information from the public, this is an ongoing story. Be brave, do something, spread these videos, and stay tuned.
So, tell me more, like, what's developing with the whole, virus mutation process?
Well, they're still kind of conducting the experiments on it, but it seems like from what I've heard, they're kind of optimizing it, but they're going slow. Everyone's very cautious, right. Obviously, don't want to kind of accelerate it too much.
Yeah.
But I think they're also just trying to do it as an exploratory thing, because you obviously don't want to advertise that you're trying to figure out future mutations.
How would the research study be delayed for COVID stuff?
Well, not for COVID specifically. So, now we're basically focusing on mRNA beyond COVID. So, for a lot of our forward-looking research studies, you got to make sure they're on track and things like that.
So, what is RNA going to be used for in the future?
Lots of stuff, but I can't tell you because you can't really.
Wait, why not? Come on, I feel like there's, it's just gonna be for flu, right?
It'll be for other things too. There's a whole list of things we're developing it for.
Bro.
Yeah, not just for viruses. So we're applying it for oncology. Well, I'm less certain about the oncology prospects, but we're doing it for gene editing.
Wow.
The portfolio has moved beyond, or at least internally, our focus areas have moved beyond COVID.
Yeah.
Now they have a dedicated COVID mRNA team who just keeps an eye on that.
Right.
And so the company has folks on okay, now where are we going to use this technology in the future? Because that's what the investors cover on now. No one gives a shit about COVID.
Right. Is Pfizer going to be held liable for any of these vaccine injuries that have happened?
I don't think so. Because usually when you give drugs, people, if there's a known side effect, it's this, it's included in that thing label, but they're creepy. There were lawsuits where Vioxx and heart attacks.
Really? Vioxx.
So that wasn't for us, that was another pharma company. We still have to do the monitoring for it over time. So there hasn't been any problems so far, but we'll see. In the next several years, if anything comes up, I'm hoping it won't, obviously.
Hope nobody's growing 3 legs or something like that, right?
Yeah, or the entire next generation is super up. Could you imagine the scandal? Oh my god. I take Pfizer off my resume. I was something irregular about their menstrual cycles, so people will have to investigate that down the line.
Yeah.
Because that is a little concerning. Because if you think about the science, it shouldn't be interacting with it's called the hypothalamus, pituitary gonadal axis.
Right.
The hormones regulate their menstrual cycles and things like that. And the vaccine shouldn't be interfering with that, so we don't really know.
It shouldn't?
It shouldn't.
But is it?
There's something happening, but we don't know what to figure out.
Well, you're a urologist, so you must understand what's going on with it, right?
So that's why I understand that it's weird.
I've heard that, just menstrual cycles and
I don't know what's going on there.
Yeah.
We don't discover something really bad down the line. I hope we don't find out that somehow this mRNA lingers in the body and then it has, because it has to be impacting something hormonal to impact menstrual cycles.
Right.
So somehow the vaccine is supposed to be interacting with the axis signal, the HPG axis, to cause these changes in menstrual cycles. Think about how the
HPG axis?
Yeah, it goes the hypothalamus, pituitary, and then gonads. They send signals to each other. Yeah.
So the HPG axis is why the fertility problems are happening.
Yeah, because they control the cycles. So if anything's impacting that, it must be impacting these hormones somehow. But then we need to figure out how are they affecting hormones? Because the signaling starts in the brain, right? And the vaccine doesn't cross the blood-brain barrier. I will say, if it does come down the line where something wrong with the vaccine, then obviously people will criticize the big push. Because there's a lot of social pressure, government pressure, job pressure to get the vaccine. I had to get the vaccine, otherwise I would have gotten fired, right?
Right.
And if something were to happen downstream and it was really bad, I think it would. The scale of that scandal would be enormous.
Hey there. Is this seat taken? You work for Pfizer. My question for you is, why does Pfizer want to hide from the public the fact that they're mutating the COVID viruses?
Is this real life? I'm literally a liar. I was trying to impress a person on a date by lying. This is absurd.
Please don't touch me. Well, this is not. By the way, don't tell anybody.
Someone who's just working at a company to literally help the public. You f***ed up. You really did. Please bring the cops as soon as possible. I'm really very unsafe.
Can you please unlock your door?
No, don't let them leave.
Please unlock the door.
What is going on here?
Please unlock the door. Please unlock the door. Unlock the door. We're trying to unlock the door. Unlock the door.
Does Pfizer not want the public to know that you guys are doing directed evolution?
Bro, what is going on here? It kind of feels like an interview. I don't know, it's freaking me out. Giving these like flashbacks to that like sting organization of like those conservative people who like randomly go into organizations and then like befriend people who work in these organizations and then report them, which happened to people at Pfizer. So it like freaks me out when people start asking a lot of questions about work. It's so scary.
Really? Oh, I'm sorry.
Yeah. Bro, why would we back on this company?
Because I just want to know the answer.
I don't know why you're recording me. Oh my god, Jason, that'd be horrible. You better not be recording me or something.
Hey there. Is this seat taken?
What?
Hi. You work for Pfizer. My question for you is, why does Pfizer want to hide from the public the fact that they're mutating the COVID viruses?
Is this real life? What is happening here?
Why?
What is going on here? This is absurd.
Why does Pfizer want to hide from the public that they're mutating the COVID virus?
Oh my god.
You're on video. You're on video. Mutating the COVID virus.
What is going on here? I need to call the police right now. This is.
And I know this is virus, so I don't know what's going on.
I don't know what's going on either. This is ridiculous.
So you're on video. I'm a journalist.
Bro, first of all, I'm literally a liar.
He's on video.
Whoa.
You're saying we're exploring how the virus keeps mutating.
Yes,
one of the things we're exploring is why don't we mutate the virus?
I don't know what's happening, but I really need the cops here right now.
So
what is this?
Please do.
Please
do call the police. Please do call the police. Please do.
You can't do this here, guys.
Okay.
You have to leave. No, you can't do this here.
You're going to call the police. He's going to call the police for asking him a question. Please do call the police. Please do. He's on tape here talking about mutating the COVID virus. Can I talk to you outside about this?
Absolutely not. You cannot use my likeness on this. What is your name? Because you fucked up. You really did. I'm about to sue you. This is absurd.
Please.
You had someone mock me as if they're going on a date to record me. You don't even know my position at this. I was trying to impress a person on a date by lying. I was literally trying.
Okay.
I'm not even a scientist by background. You know that I came from a consulting firm that does business. This is absurd.
Please don't touch me.
This is absurd.
So,
please call the cops here.
Please do call the cops. Please do.
Please.
Why would you call the cops if you have nothing to hide? So he's obviously having one of the most outrageous reactions I've ever seen in the history of Project Veritas. He's threatening to call the police. Okay. He grabbed the microphone. The question is, why is he calling the police?
Guys, can you just respect my father's please
stop.
What? Can I pay their bill? Can I get a check for their bill? Please?
No, do not give me your check. No, don't let them leave. Because I want the cops to know this.
Do you want to put me in jail for asking you a question?
Yes, sir.
What is the intention of calling the police?
They have like no one's injured right now. We have several witnesses.
Could I talk to you, please, about this video?
Okay, so there's 1, 2, 3, 4, 5 white people.
Why would you bring race into this?
Please bring the cops as soon as possible. I'm really very unsafe.
We have you on tape talking about mutating the COVID virus.
No one mutates a COVID virus.
Show you the May I show you the video?
No, I want to call the police. Please don't let them leave.
Do we have to leave?
Yes.
Okay.
Sorry, I asked a question. I couldn't.
No, you cannot just leave.
Do you want me to leave?
I want the police to come here and see all of you people. Because this is insane.
Can I ask you about this
is
video?
Insane.
Please.
You can tell them about how I was lying to impress
Here,
a date.
just was it true what you said?
What is this? No. I literally was on a third date with a guy, and like normal men, you lie to impress a date.
Mutating viruses? Do you not work for Pfizer?
This guy, I thought he was a date.
Sir, do you not work for Pfizer? Do you work
I
for?
was a contractor. What the fuck are you?
Do you currently work for Pfizer? Yes or no? Do you currently work for Pfizer? Yes or no?
What are you talking about here? Please, I want the cops to be here.
So you don't work for Pfizer?
You can't do this to people. This is absurd.
He doesn't want me to leave, ma'am.
Don't let them leave. I want the cops here now.
He wants the cops here, but he doesn't want me to leave. So I'm in a little bit of a predicament because she's asking me to leave, but he doesn't want me to leave. So what should we do?
Okay, so these people have just, I was on a
Hi,
date.
you're on a video
and
here.
These people literally left
Look,
out of nowhere.
Pfizer is mutating the virus.
This is absurd.
Look at this
no,
video.
I literally said that is, what are you talking about?
Well, this is not, by the way,
Why are you doing
don't
this
tell
to
anybody.
someone who's just working at a company to literally help the public.
Why do you want to hide it from the
I don't know
public?
who you people are, and I can't believe I'm going to trust someone.
Why do you want to hide it from the public?
Stop all this stuff aside. I'm a real person.
If you suspect that mutating COVID virus, is this the way the virus started in Wuhan?
Please, Ed, can you please get this on video?
Why do you think it's okay for Pfizer to do that?
We were sitting on a date. Can you explain what happened to me? Please,
He's filming the restaurant owner right now. He's filming her. I don't know why he's filming her.
No, don't listen.
Would you like me to leave? Because he won't. He's asking me not to leave, and he's consenting to my presence. Ma'am, are we allowed to just stay and ask a few questions? It's pretty remarkable that they call the police on us every time we show up and ask questions. Every time. You say Pfizer is planning on doing research in the future, then claim that there's an ongoing research about that, and that there better not be any more outbreaks. Which is it? Are these experiments happening or not? Calling the police.
We can do it right up front.
Okay.
No, do not leave. Do not leave. Please don't let them leave.
What's that?
Oh, they locked us in here.
They locked us in here.
Wow, look at that.
Yeah. Do you want us to leave or not?
Ma'am, you locked the door.
Ma'am?
Ma'am, we're trying to leave, but you locked us in here.
Call our attorney.
Can you please unlock your door? Let us out.
No, I don't know what's going on. I don't want anyone leaving before I know what's going on. What if you try to kill me?
Can you please unlock your door?
No, don't let them leave.
Can you unlock the door?
I still like saying that. Please, no, don't let them out. Don't let them out.
Could you please let us leave, ma'am?
I don't know what's happening. You can't lock us in.
We'd like to leave. We'd like to leave. Please unlock the door.
Like, see, now they're worried because they know what they're doing.
It's because we're literally being trapped.
Stop. Away from me.
Please unlock the door.
Give me, what is going on
some
here?
stuff. Please unlock the door. Please unlock the door. 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 This is remarkable here. Thank you. Thank you. They're trying to unlock the door. Unlock the door. Unlock the door.
It's not okay
Unlock
to
the door.
people like that. It is not. Stop. Let go of me. Now you're hurting me. What is going on here? You cannot just record people like that.
Come on.
It's not okay.
Come on.
It's not okay.
Let's go. Let's go. Come on. Let's go. Let's go. Come on. We're in New York City. This is remarkable what you just witnessed here in the restaurant. Come on, guys. Where's the car? Where's the vehicle?
Keep walking.
Come on. This is insane. You just witnessed one of the most remarkable interactions ever. Do we have the iPad? So we're getting into the vehicle now. Where's our car?
Stop. Stop. That's not them. Stop. Cops, they're right there. No. Stop.
He's charging the guy, charging.
You can't make an arrest at this point if you don't have the victim right here.
Okay. 'Cause if he was here, you'd arrest that guy?
If he was here, yes.
Oh, then we could just walk away then. Not worry about it.
If that's what you guys want to do, then yes.
name and chemical, which makes the alleged ingredient, and the ingredient list for the Moderna vaccine to find out.
The Moderna vaccine does contain SM-102.
Unfortunately, you are not the only person that misunderstood what I was saying. See, back in early 2013, I participated in an mRNA-based immunomodulatory medication trial. So yeah, a medical trial on an mRNA-based medication that was meant to alter how the T cells produced antibodies. And it worked phenomenally for not just lupus, but ulcerative colitis, Crohn's disease, multiple sclerosis as well. Here's the kicker. Out of that trial, there were over 200,000 participants. And every last one of us, including myself, had their hearts stop. There's less than 5 of us that are still alive today, but all of us experienced our hearts stopping at least once. According to my doctor, less than 5 of us are still alive. This medication was a series of injections that occurred over about a year, and the complications took 2 years to pop up. Cancer, heart attack, stroke, that kind of stuff. Myocarditis. So no, I didn't commit government-assisted suicide. Tell me you've never been to college without actually saying you never went to college. Because the thing about a medical trial, or a medical experiment where they're using stage 3 human testing to see if a medication is actually efficacious, if it does not show what the pharmaceutical company wants it to show in that study, and that drug does not pass FDA testing, that's because it killed over 2% of the people that were in that trial. Typically what happens then is that pharmaceutical company goes out and it pays everybody that was part of the trial and experienced side effects, pays them by paying their medical bills, and gets them to sign a non-disclosure agreement in order to do so. So no, you're not going to find it anywhere. They destroy it. They bury the data because they don't want you to know that pharmaceutical companies kill more people than wars do in America. You can go ahead and look into that. Since 1920, doctors have killed over 200 million Americans. They've killed way more than wars ever have. Just FYI. And since you called me a liar, open heart surgery. Lost my colon, 3 strokes.